Pathologists play a very important and essential role in diagnosis. Let us understand from a treating doctor how a pathologist and his report make a difference in treatment of a patient.
Whenever patient comes to us, we have 4 to 5 differential diagnoses which a clinician has as a initially. But to come at a exact diagnosis, the role of pathologist is very important because you have to narrow down to one diagnosis and accordingly treat it. So the pathologist's role for making the accurate diagnosis, and ultimately the whole treatment depends on the diagnosis.
Diagnosis part of a clinician has got three aspects. The first, a patient comes with some symptoms. He analyzes those symptoms, then he takes his history, and all this history and his symptoms are one part. The second aspect, he examines him physically, and that examination, like he's taking his temperature, his pulse, his blood pressure, or maybe auscultating or percussing this thing, palpating his abdomen and other things. All these things are the second part of his clinical examination. With these two, he forms an opinion, a working diagnosis. Like the patient may be having something. Suppose a patient comes with fever. So this may be a typhoid fever or a malaria fever or some tuberculosis. He thinks about that, and that is called as differential diagnosis. So to differentiate between two diagnoses, he needs a third aspect, and that third thing is provided by these pathology laboratories and other investigations. So to complete the diagnosis, the laboratory tests are really essential. Without that, no diagnosis can be confirmed.